Thanks so much for joining us, firstly. We really appreciate your time and looking forward to a bit of your insight into your clinic. And I guess the first question I wanted to ask you is a bit about your role at the Brisbane Eye Health Centre. And I know that you're an optometrist practicing in a large ophthalmology setting, so it'd be good to have a bit of an understanding of exactly what you do.
Yeah, Lockie. So I met Dr. Appel back in 2001, and optometry and ophthalmology were sort of almost at arm's length back then. And we sort of started to foster a relationship where optometry could really support ophthalmology and actually improve their efficiency. And so my role has evolved from basically working with Dr. Appel to now managing his optometry team, which is 11 strong now across 4 locations in Brisbane, working with 4 different ophthalmologists. So the role has certainly grown. And with that, I suppose, there's been expectations. Ophthalmologists like things to run as best as they can. And such, I'm always looking for efficiencies to basically help my optometry team reach those high expectations which my doctors expect.
Very cool. And is there, as an optometrist, is there something in particular that you are clinically interested in? Do you have a particular specialty or focus when you practice?
Yeah, so what I discovered working with refractive surgeons is that the role of the tear film and indeed managing dry eye is actually monumental and I think often been overlooked or even trivialized in terms of its management. And, in trying to achieve the outcomes that we try and achieve at the Eye Health Centre, having a whole team and a whole clinic and even a sub-clinic dedicated to dry eye has certainly allowed us to achieve much better outcomes for our patients in a refractive sense.
Yeah, great. Yeah, I've seen a bit of your content around some of the specialty tools you use for dry eye, and it's really interesting. I've seen a bit of your work online already, which is really fascinating. I'm going to make a bit of a brash segue into Harmony, if that's okay, because I know that you guys have been using it for a while now. So I'm keen to hear a little bit about how you've used it. So is there one feature in Harmony that you've found surprising and really helpful in your practice?
Yeah, so lucky for me, the single biggest thing is the ability to integrate with multiple other devices from other companies. We've sort of found as our workplaces needed more and more equipment which has some sort of Windows or computer background to it, there's also been this reluctance for companies to allow their data to be shared. Yet, as an ophthalmologist, as an optometrist, we want to look at all the data from all the machines at the same time. So it never used to be a problem 10 years ago because we used to use manual machines. But with the advent of more and more devices requiring a computer, I've had this constant challenge of getting computers to talk to each other, devices to share information. And there have been other platforms which have sort of dabbled in this, but there's always been this sort of, dare I say it, company skew where the platform may work really well with some devices, but not others. And I work in a real practice where devices change. You know, Gold standards can change. So you might have the best machine in the 1980s. It's a doorstopper in the 1990s. Do you know what I mean? So I need to be able to evolve my machines and have a platform that talks to all machines from all manufacturers.
Yeah, it's an interesting one because I look at similarities between this situation and the whole dichotomy between Apple and Android. That I feel that there's a lot of similarities in the world that we live in now, and everything needs cross interconnection, and the demands of optometry and ophthalmology are becoming more so, particularly with involvement with the cloud.
Yeah.
Do you think that cloud management of data is going to be bigger and bigger in the future? Like PAC systems as a whole in the US is obviously a really big thing. But do you think that as we move into the future that more platforms like EMRs and what have you are going to move into the cloud?
Oh, look, absolutely right, Lockie. Like when I'm not working with the Eye Health Centre, I work with a large retail group, and I've seen there just how quickly you can add a new bit of technology, which has now got a higher megapixel camera or a greater degree of 3D trickery and imagery, and it can literally just destroy, your basic practice management software. So I think we're realizing that we just can't keep up from a hardware point of view, the storage capacity which modern machines, require. But not just that, it's longevity. So it might work great for the first, 3 or 4 years, but when you're seeing a glaucoma patient like we do, who saw Dr. Appel's father back in the 1920s, right? You could have records of 70 or 80 years. If you've attached to that 10 megabytes of data every year for 80 years, it's going to kill most, hardware platforms. So I think the idea of cloud storage. I think the idea of being able to share it across multiple sites and platforms, I think is the way we need to move with with the way data is being managed.
Yeah. So speaking of, I guess, giving everything into the one window is one part of what Harmony can do. Do you feel that the automation of allowing the patient work list has sort of increased the amount of patients you've been able to see? Like roughly how many patients do you think you see a day? And then because of the automation that Harmony gives as far as entering patient names, how much time do you think you're saving per patient across a whole appointment?
Yeah. Look, to be completely honest, Lockie, when you first approached me, it was that component of Harney that actually excited me more because I had seen sort of other platforms trying to integrate multiple scans. But to me, that is a huge challenge. On a busy clinic, we can have 70 patients. And if you think that out of that 70 patients, maybe 70% of them are there for cataract surgery or refractive surgery, they then require potentially 5 or 6 different scans prior to seeing the ophthalmologist. You are entering the patient's name and their birth date 5 or 6 times. So, two things concern me. Firstly, there's a lot of room for data entry errors because you have a human being putting it in 5 or 6 times in different machines. And the funny thing is, some want the surname first, some want the first name first, some want the date of birth, with the year first, others want the day first. So, there's so much room for duplication of records and human error. So to me, Harmony has been incredible in that once the patients are in the waiting room, and the front desk staff have said they're here, every machine in that room will have that patient's data pre-populated, and it will be exactly the same from machine to machine. So the time saving is quite phenomenal.
Yep. Awesome. Yeah. And you really avoid that situation where you've got one patient going into the wrong patient file, which could be catastrophic, particularly with some of these disease states that require longitudinal analysis. So it's something that I'm really excited about. So look, thank you so much for providing a bit of your insight into your clinic. We at Topcon here think you guys are doing such a fantastic job for eye health here in Australia, your team and Dr. Andrew Appel. And so thank you again. Thanks, everyone.